Yes.
Okay, next slide.
Okay.
Okay.
All right. So if you've read and understood, considering it communication skills station, please begin.
Hi, my name is Dr. Fyong. I'm the ST1 working for the General Surgery Consultant. I'm calling to speak with the Cardiothoracic Consultant concerning a polytraumatized patient with widened mediastinum. Please, can I confirm that I'm speaking with the Cardiothoracic Consultant?
Yes, speaking. Kindly summarize your case.
Okay. Patient is a
Yes.
patient is please can you
Yes.
okay. Yes, it's a 23-year-old motorcyclist that presented to the A&E with complaints of right-sided chest pain and left leg swelling. And he's also a non-diabetic. And on examination, his GCS was 14, heart rate is 120, blood pressure 100/80, and his temperature is 37 degrees Celsius. Then the available lab investigation shows that his hemoglobin is 8 and his EUC and LFT are normal. The CRP is slightly raised and his arterial blood gas shows pH of 7.32 and decreased bicarbonate, which is suggestive of metabolic acidosis. And on examination of the limbs, the left thigh is swollen with open wounds. Then the available imaging shows a chest X-ray with widened mediastinum and bilateral pleural effusion, and an abdominal X-ray showing swart shadow being absent and dilated small bowel loops, and his left femur X-ray showed fracture of the femoral shaft, and there's a chest tube inserted on the right side of his chest. He has also received about 4 liters of crystalloids.
All right.
So, uh,
Yes.
okay,
Continue.
so our concern is with the chest X-ray showing the widened mediastinum and the possibility of a likely traumatic aortic dissection, and why we want to refer the case to you.
Okay, considering that you've said that patient has widened mediastinum, has any CT scan been done yet?
Oh, I'm so sorry to unfortunately we've not been able to do a CT scan yet because he's currently out of service. But I as soon as I'm done with the call, I'll still make arrangements to do a CT scan for the patient.
Okay, what about the cervical collar? Has the patient got cervical collar?
Oh, I'm sorry again. I can't really tell, but I'll as soon as we are done with the call, I'll go back and do a triple immobilization by fixing a C collar and then sandbags with a strap.
All right, okay. How are you going to take care of the patient's blood pressure?
Okay, we already started fluid resuscitation with crystalloids, and we'll be careful to ensure that the systolic blood pressure does not go beyond 100 millimeter mercury in order not to increase the bleeding. And then we'll continue monitoring the patient closely. And we've already group and cross-matched 4 units of blood. Should in case the patient is not responding to fluid resuscitation, we'll consider blood transfusion.
Why patient has got hemoglobin as 8? Is there any ongoing bleeding?
Yes, there's likely an ongoing bleeding, most likely from a major vessel in the thorax. And also the abdominal X-ray showed absent SWAS shadow, which is suggestive or could be suggestive of a retroperitoneal bleed. And then the left femoral fracture
Okay.
X-ray that only confirmed that it's like the patient can be bleeding from the left femur too.
What is the abdominal issue? Do you think you would require exploratory laparotomy?
Yes, very likely the patient may require exploratory laparotomy because the X-ray finding of there being an absent swart shadow is likely in keeping with a retroperitoneal bleed, and which will require an exploratory laparotomy.
How are you going to take care of the leg of the patient?
Okay, I'll splint with a Thomas splint, and then
Okay.
I'll also inform the orthopedic consultant.
Yes. And you said chest tube has been inserted. How much is the reading?
Currently is okay. I'm assuming from the notes 200 mils, but
Okay.
from the stem there was no information about that. So
When there is widened mediastinum, then why is it just showing 2 ml, 200 ml?
okay, because the chest tube is inserted in the pleural space.
Yes.
And the likely source of bleeding, which we are suspecting to be a major vessel in the thorax, is in the mediastinum. So the volume in the chest tube may not be reflective of the ongoing bleeding in the mediastinum because chest tube lies in the pleural cavity.
Okay, what are the causes of metabolic acidosis in this patient?
Okay, the patient is likely in hypovolemic shock, and in shock there is anaerobic metabolism resulting in production of excessive lactic acid, and that can cause metabolic acidosis. Also, the patient is a known type 2 diabetes, so it could also be diabetic ketoacidosis.
Yes, and
And
any other causes? Okay.
um,
You said patient is in hemorrhagic shock. Could there be any other type of shock which patient might be going through?
yes, patient it could be a cardiogenic shock too, maybe due
Yes,
to
and
blunt trauma to the chest,
yes,
and
and
obstructive shock
okay,
in form of a cardiac tamponade likely.
okay. Would you consider patient undergoing or in present in septic shock?
The temperature is 37. Is unlikely the patient
Okay,
is in septic
good.
shock.
So answer is no. All
No.
right, okay. You've told me. Then who is going to accompany the patient?
Okay, I'll contact my anesthesiologist colleague to accompany me during the transfer.
The whole trauma team,
Okay, the trauma team. Okay.
including the anesthetic.
Okay, thank you.
Right, okay. Right, okay. What other, okay, how would you be monitoring the patient meanwhile?
Okay, so uh since the hemoglobin is dropping, so
Yes,
I'll first of all start with fluid resuscitation,
yes.
making sure the systolic does not go beyond 100. So I'll continue monitoring the level of hydration by one, the mental status of the patient, the pulse rate, the capillary refill, and then having passed the urethral catheter, I also monitor the urine output very closely. And if no response, then I'll consider blood
All
transfusion.
right, good. You can transfer the patient. Thanks.
Okay. Thank you very much.